Hi, my name is Ryan Zengou, and I'm a neurosurgeon. Neurosurgery was a different road. Initially started wanting to be a cardiologist. When I was in medical school, I started to do rotations with different surgical specialties, and I really found neurosurgery fascinating as we work under the microscope, working with very small things. I love the brain. That is the best organ. There's no replacement for it. There's no transplant for it, and it's really who makes us who we are. It's how you feel when you love your child, your wife, your spouse. It's who we are as people. It allows us to communicate. I think it's the most important organ. So neurosurgery, a general neurosurgeon like myself, we do everything. Stuff with the brain, surgery with the spine, peripheral nerves, and there are guys who specialize in more one than the other. As a neurosurgeon, the things that I commonly treat, most neurosurgeons treat, are things related to problems with the spine, the nerves in the spine that come out of the spine that go to our arms and legs, things related to brain tumors, vascular problems in the brain. Those are probably the most common things that neurosurgeons do treat, spine being number one and brain issues being number two. So when patients come to see me, they oftentimes already have a problem identified. Either the primary care physician or another physician has identified something on an imaging sequence, whether it's an MRI or a CAT scan. That can lead to further imaging, such as more advanced imaging like an MRI, to further identify the problem to come up with a solution. First thing I tell people is the surgery is not always the first answer, especially with a lot of spine issues. We try things that are conservative and even some brain issues too. There are benign tumors that we do see where we can just watch and wait and see how they do over time, if they grow or if they don't grow. So I think when a patient comes in to see me, I'm not going to immediately jump to surgery unless it's absolutely necessary. And then we talk about the options of that surgery and how to approach it. My treatment philosophy is simple. I treat every patient how I would want to be treated or how I'd want my family to be treated. I think what's important in getting to know me is that I want you to come into the office. I understand you're nervous. I'm going to address that. And my primary goal is to have you leave the office feeling better than when you came in.